Guys, we are going to go ahead and do some injuries today. And basically, I'm just going to talk for about 20 minutes because that's about the amount of work that I'm supposed to give you. And we'll see how far we get. And then tomorrow, you need to be prepared for a little quiz over like what we've done today and what you were supposed to do yesterday. Um, and that quiz will I'll give you a couple of attempts at it. So if you've done what you're supposed to do, then you should be okay. All right, so an acromioclavicular joint sprain. So remember, this is what the joint is between the acromion process and the clavicle. So like right here is where it is. And usually this happens because someone gets hit or they fall on an outstretched arm. So you're going to see a theme here about that, like falling on an outstretched arm. So the signs, they will have point tenderness and pain with movement, but with a grade 1, there's not going to be any disruption of that joint. If they partially tear it, then that lateral end of that clavicle might be a little bit moved, and they might have decreased range of motion. And then if they completely rupture those ligaments, the acromioclavicular and the coracoclavicular, which is like the coracoid process is just down a little bit from it, then there would be gross deformity. So what do you do for it? Well, it's very simple, actually. You just need to ice it, stabilize it, and refer to a physician. So you don't need to try to do anything else with that injury. So feel free to pause, type, do whatever you need to do at this point. But I'm going to go ahead and go on to the next slide, which is special tests. So if you scroll down to the bottom of your chart, there is a place for special tests, but I will give you I'll give it all to you at the end, so you can just fill it in at that point. Oh, I went away. Where'd I go? There I am. Okay, I'm going to go ahead and hide myself so you guys can see the whole screens, but you can still hear me talking. So there's 4 tests you would do. So you can see in this one, the AC stability test. So he's just going to apply pressure from the front, from the back, and from both sides. And then the O'Brien's test, we will watch right here.
Perform O'Brien's test, point the thumb down and flex the shoulder to 90 degrees. Adduct the arm across midline. Provide resistance against further shoulder flexion and evaluate for pain. Repeat with the thumb pointing up and again evaluate for pain. If pain was present with the thumb down but relieved with the thumb up, it is considered a positive test, suspicious for labral tear.
Okay, and they said suspicious for labral tear, but also for AC joint instability. Okay, so that's O'Brien's test. Like I said, I'll give you all of that typed up at the end. Okay, shoulder impingement syndrome. So impingement by nature is just like there's not enough space for something. So this is the compression of the supraspinatus tendon. Supraspinatus, remember we talked about this. This is the muscle that's above the spine on the scapula. It also can get into the subacromial space, so use your knowledge on that one. Sub meaning below, acromial meaning acromion. So there's a bursa right below that. And then which is right here. And then there's the long head of the biceps tendon. Also, so the biceps tendon right here runs through there. So there's not enough room under there. And we see this a lot in overhead repetitive activities. So tennis, volleyball, baseball, softball, swimming. Those are really common. So it's going to be a diffuse pain. They're not going to be able to say it's in one spot. And there'll be pain upon palpation. They'll have decreased strength of their external rotators, and then positive impingement and empty can test, which we'll look at in a second. So one of the main things you need to do with these is restore normal biomechanics in order to maintain that space between there. So if there's a way that they're moving their arm that's not working, then you need to work with them in therapy on getting it moving the right way. Also strengthening of the rotator cuff and the scapula stabilizing muscles. So the rotator cuff is supraspinatus, infraspinatus, subscapularis, and teres minor. And then the stretching, and then you could modify some activity as well. So we do 2 tests for shoulder impingement. So we do what's called the Neers test, and we do the Hawkins test. Whoops, there's the APC workout for anyone that wants it. So Neers test. Okay, we're back. Sorry about that. I started to play the video and it used inappropriate language, so I had to stop. But here we are. Here's the Neers test.
Used in the assessment of shoulder impingement. According to a big study by Hadjidas et al. From the year 2012, its sensitivity is 72% and the specificity is rated at 60%. To conduct the Neer test, have your patient in a sitting position. With one hand, depress the scapula, and with the other hand, internally rotate the patient's arm, and then perform maximally forced forward flexion in the glenohumeral joint. A positive test is pain reproduction on the injured side. If you remember the shoulder impingement algorithm from Coates et al., you can evaluate the outcome of the Neer.
Okay, so that was
Commonly used test in the assessment of shoulder impingement. According to a big study done by Hadjidas et al. In the year 2012, the sensitivity is at 80% and its specificity is rated at 56%. To perform the Hawkins-Kennedy test, have your patient in sitting position. Elevate the arm to 90 degrees of forward flexion and have it rest on one of your arms. Then perform passive internal rotation. A positive test is the provocation of pain. If your patient has pain during the test, this can be an indication of a subacromial impingement. The test will...
Okay, so that's Hawkins-Kennedy. Okay, so those are our 2 tests for shoulder impingement syndrome. Okay, next injury is a rotator cuff tear. And we're talking mainly here about the supraspinatus because I said that you should have learned yesterday, I believe, that there were the 4 muscles that make up the rotator cuff. And we're talking today specifically about a supraspinatus specific tear. So the primary mechanism is acute trauma, so high velocity rotation. So they're trying to throw a ball or they reach their arm up over their head really fast or something like that. It usually occurs near the insertion on the greater tuberosity. And it generally, we don't see this very often in athletes under 40. It's going to hurt. So it's going to be pain, tender. They won't be able to use it as well. It will be swollen. And then if we have a complete tear, then impingement test, so the ones that we just did, and also empty can test, which we'll do in a minute, are positive. So you can, obviously, you guys know you can have surgery for this, but you can also just RICE and then do some progressive strengthening and reduce activity. And that, in a lot of cases, will take care of it. Pause if you need to. I'm going to go on to the special tests for this, which are the drop arm test and the empty can test. So I don't think I have the videos pulled up for these because they're very simple. So the drop arm test, you're going to have the person hold their arm out to their side, and then you want them to slowly lower their arm back in. If they can't control that, then that says that there's something wrong with that muscle because that muscle is what helps us to slow down our adduction. So immediate drop of the arm would be a positive test or a positive result for supraspinatus muscle injury. The empty can test is exactly what it sounds like. Okay, so you're going to have the patient turn their thumb down, and you are going to slightly push down as they are trying to resist you. So it's called the empty can because you're going to like empty a can as you're pouring it. Okay, so those are the 2 tests for rotator cuff tear. Okay. I believe this is our last injury of the day. Yes. So bicep tenosynovitis, repetitive overhead athlete. So you can see right here, that the bicep tendon comes in right through this, what's called the bicipital groove. And so a lot of times we get irritation of that right there. So repetitive overhead athletes, swimmers, baseball, softball, volleyball, tennis, typically. It's going to be tender right there, swelling. You might have some crepitus. Remember, that's like that creaking noise. And then pain when they do overhead activities. And this is very basic treatment for tendonitis, right? Remember, though, tenosynovitis is the sheath around the tendon. It's not necessarily the tendon. It's that sheath. So rest and ice, take some NSAIDs, and then a gradual like strengthening and stretching program. And then our special tests, we have two. They are Yergeson and Speed. We're almost done. Hang in there with me, guys. Here are the Yergeson and Speed's tests.
Checking for stability or presence of the transverse humeral ligament, holding the long head of the biceps in place. If the ligament is torn or stretched, a lot of times you'll get subluxation of the long head of the biceps. Patient may complain of clicking, discomfort in the proximal aspect of the biceps. With this test, you'll have the patient standing. She'll have the arm at 90 degrees adducted to her side, fully pronated, and with the test, I'm going to resist two motions, principally. I'm going to resist supination and external rotation at the same time, while I'm palpating the bicipital groove. So with the test, I'll ask her to push against me, and then also have her supinate. So I'm going to resist supination, external rotation, and with the test, if it's a positive test, and there's a transverse humeral ligament is torn, you'll get snapping, positive test of snapping of the long head of the biceps coming out of the bicipital groove. So once again, Yergeson test, resisted, supination, external rotation as we palpate, and there'll be an audible clicking or subluxation of the long head of the biceps.
Okay. So, oh no, I didn't want to click on that. Oh boy, let's just close this out. All right, and then the last one is Speed's test.
Her arm against your resistance with the arm supinated. Pain indicates biceps tendon or labral pathology.
Okay, so Speed's test is simply you push down and they try to resist you pushing up against that. Okay, so for today, remember you need to do that discussion post. So if we go back here, this is not your class. You will see that you do have a discussion due today. So right in here, maybe. Here we go. March 17th discussion. Oh, it looks like it has 2 replies. I wonder who it is. Oh, it's me. So what's your favorite way to waste time? So I thought this was an appropriate way to start because we know we're going to have potentially a lot of time to waste, over the next few weeks. So, create a new post and then be sure to read what your classmates have to say and feel free to respond to. You can do a video post if you want, whatever you're feeling. So my current favorite way to waste time is to watch New Amsterdam and tidy up around the house. I'm trying to get stuff put away from when we moved in. I know that was a long time ago. And, I also am enjoying reading the book Just Mercy. Okay, so I submitted a video in case you want to watch it. So do that. That's your attendance for today. And then you're done. Okay, I'll see you guys tomorrow. Bye.